This is Judy Williams from Early Learning Ventures. I'm the Executive Director, and I really appreciate everybody getting on the call with us today. We just really wanted to share out with all the groups that we've had been working with, sort of what we've been up to over the last year in 2016 and what we're moving into in 2017 to share with you. Hold on one second. Okay, so we'll go ahead and get started. Early Learning Ventures has been in business for about 8 years now, and what we were started to do was we started as an initiative of the David and Laura Mirage Foundation, who are very passionate about making an investment in the early childhood sector. They really were concerned with specifically the children and the families and being able to access high quality childcare, and really wanted to make an investment coming at it at a different angle. And so that's what we were charged with in 2008, was to look at how could we make a difference to improve the quality of childcare in the childcare market that helps all children and families. And so where we really started landing on was business services, and how could we really look at the business services to do that. So to fast forward to today, Early Learning Ventures was started as an initiative of the Mirage Foundation, became a private nonprofit operating foundation, and then just this year we are now a full nonprofit charitable organization, and that's due to our expansion plus our diversified of funding. So that's where we are today, but still with the same mission and goals that we really want to come in and help the child care market improve the quality of child care that's being delivered to all children and families. And so we really do that through an infrastructure of a business model that really equips child care programs and gives them supports and services so that they can serve all the children and families in their care in a much higher quality service, as well as get the outcomes for children. Next slide, Mia. So just to give a little more history, you know, the child care opportunity that we saw was that there is a child care market out there serving a lot of children and families of all incomes, but specifically a lot of children, low-income working families. And how do we leverage that private sector, bring support to them so that they can increase the quality of care and become a stronger business, as well as blur the lines of what's child care and what's early child care education, etc. So the national child care market looks like this. There's over 15 million children possibly in need of child care with working families. And in Colorado, that is about 250 children in need of child care with only about 200 licensed child care slots. Next slide, Mia. And in Colorado, which is our market where we started to do sort of a proof of concept over these 8 years, this is what the child care market looks like, our customer base. It's over 1,300 child care centers, over 2,300 family child care homes, and you can see that it's very expensive for infant and child care in the state of Colorado. So that is what our market has been, is to really look at how can we bring supports, business supports to this market so they can do what they do best. They can focus on delivering high quality child care. Next slide, Mia. And when we started at this, I think the research shows, and everybody on the phone probably knows this, that all the research shows that these are the pillars to get high quality child care, early childhood education, and to get the outcomes that we all want for children. And you can read that for yourself, but we know that the lower ratios, higher staff qualifications, having a curriculum, having a high quality learning environment, all of these things, it's not news to people that those are the pillars that it takes to deliver high quality child care and to get the outcomes for society. But you also, as you can see, need a strong business. You need the business to be in business so that they can continue to work on these things. Unfortunately, this is what the child care market looks like, and for a lot of reasons. To deliver higher quality care is more expensive. But even when you have a weak business foundation, when I say weak, meaning it's you by yourself trying to you know, do all the things that you need to do to keep your business afloat, as well as in a licensed business, do all the things that you need to do to be in compliance so that your business is strong, as well as you know, the iron triangle that Louise Stoney talks about a lot is making sure that you're fully enrolled, that you're fully collecting all of your funding streams so that you actually have the finances to do a strong business. So this is the problem we set out with our initiative in terms of business services to help support. Next slide, Mia. So today, fast forward, we've gone through a lot of changes over 8 years, and you know, having an initial investor of the Mirage Foundation, it was such a blessing to be able to just try things, and when they didn't work, we had the flexibility to try it again, to change it, and so forth. So today, what we have is a statewide Early Learning Ventures Alliance, which delivers 2 sets of services. It delivers business services, which we still believe is the infrastructure needed to deliver high-quality child care and get the outcomes we all want for children. And so those strong business services are really focused on sharing resources and to helping offload as much of the administrative burdens as possible that weigh a child care program down when they really need to be focusing on delivering and what they're good at, doing what's great for children and families, as well as the financial services that are required to make sure that you're collecting all of the revenue sources. So that is what we call our stronger business practice. We deliver that using technology as well as hands-on support to make sure that providers are utilizing the technology and getting all the benefits and value so that they can actually actualize more time and money into their program, and then they can reallocate that and focus on building the quality and delivering the quality. Over the years, though, what we saw is as we get providers stronger in their business and getting them up to a stronger business, there still needs to be more money for them to step up and deliver those pillars that we showed on the first slide. And that's going to take more funding into the sector. And so we started what we kind of have called our stronger business practice. And we're doing this with funders that are able to come in and through our network of child care providers in Colorado, we're able to deliver out and give some support on the quality side to help build those stronger quality services for children and families. So that's kind of high level where we started, where we are today, and we're going to dig a little deeper, and I'm going to turn it over to Mia to kind of talk more in depth about our business services.
Thank you, Judy. That was a great overview. And I'm going to go a little bit deeper into our business resources, like Judy said. The first point of entry we have for most users in our system is the resource platform, and that is powered by CCA Global. ELV was the first group to bring the system to market, and it's since expanded to 26 or 27 different states, I believe. And this is where we bring providers into the idea of shared services, and they can start getting really immediate access to things like cost savings, you know, a whole cache of virtual child care business operations, including curriculum templates, employee and parent handbooks, HR policies and procedures, different marketing tools, etc. So really you can think of it as the one place they can go where they can find almost anything they need to operate their program. It's very easy to use, it's very user-friendly, and it's a great starting point for them to start looking at their operations and finding some really easy and attainable ways to make time savings and dollar savings. During 2016, we made some pretty significant updates to the resource platform. We updated its appearance and functionality, so now it's easier for new users to request access. So the bigger we get and the more momentum we get going, the more people are seeking out our services, and so this makes it easier for them to request access to it and us to follow up with them. More than 80 new resources have been added so far this year, including whole pages, areas on the CCDBG grant, for instance, different quality improvement strategies and techniques, trainings, templates, and much more, new vendors. We've added a ton of stuff, and we're able to add resources through the partnership with CCA Global, as well as add our own Colorado-specific resources for those pieces that are more statewide or local to our members. We've also built out a toolkit to align with Colorado Shines, which is Colorado's new QRIS system, and we've built that to help them really solidify what they need to do to move through the different levels and the different criteria to earn points. So, for example, parent engagement might be a big focal point that a provider would be working on, and the criteria might say You can meet this through these 3 different ways, and one of them is a parent survey. While the resource platform has an introduction letter to parents describing a parent survey, it has a whole guide on how to build a strong early childhood specific parent survey and to use it with your families. And then we also have a template which is modifiable so that the provider can take out questions that don't pertain to their program or add other questions that do. And this really concretely helps them improve their quality without having to start from scratch and building a parent survey, for example. Our next point of service is Alliance Core, which is our record-keeping and compliance system. And we've done a huge amount of work on this system this year. We've really taken it from where it was, which is a really good starting point for shared services work, and expanded it to be competitive with any other shelf product on the market, as well as help us in our compliance with early Head Start PAR reporting and oversight. So this system is a first-of-its-kind web-based child management system that not only provides everything a child care provider needs to manage its child, parent, and staff files, but also links to child care licensing in Colorado so that they can use the system remotely to check files for families, children, and staff before they do their inspection visits, as well as help providers on making sure they're in compliance. In 2016, in the first quarter, we did a major system upgrade. We switched to a faster server. We've added a lot of great functionality, and as such, we have some pretty happy customers who have been really great at helping us figure out what does the end user need, how does the end user utilize the system best, and how do we integrate all these different pieces and focal points and still keep it a system that's user-friendly and saving people time. So things we've added this year include online enrollment, parent email and parent texting capability, a tuition billing module, which is separate from our financial services, which I'll get into next, as well as an early Head Start data capture. So a lot of programs use a child management system and then a separate system for early Head Start or Head Start compliance tracking. And we really feel strongly that the more you can use one system all together, the more streamlined, the more efficient, the better oversight, the fewer gaps, the fewer holes, the fewer piecing together, and the greater your success will be. So we've worked really hard this year to build a tool that can be used by all sorts of different groups and agencies to track the work they're doing, to allow greater transparency into the work, and to allow us to ensure the highest and utmost level of compliance with whatever regulatory agency we're looking at, whether it be child care licensing, the Child and Adult Care Food Program, different subsidy programs, or early Head Start. So we've made a lot of strides this year with Alliance Core. Our next level of service is financial services, which throughout all our work in the last 8 or so years, we've looked at different iterations of how to provide financial services to child care providers. The idea is that we want to offload as much as possible the time they spend invoicing parents, sort of running around for them, asking for tuition payments, and then trying to piece together, did I receive payment from that person? Did I receive payment from that subsidy agency? Where am I in Q3 compared to where I was budgeted to be? And so we contract with a third-party vendor to provide financial services to our members. They typically provide financial services only to nonprofit agencies, but because ELV is a nonprofit, we're able to extend utilization of the service to our members. And so this goes beyond traditional tuition billing and payment processing to also include things like payroll, financial reporting, tax prep, and more. And we were able to, partly through the enhancements we made to Alliance Core, we were able to decrease the labor costs of our financial services partner in 2016, which resulted in a 30 to 50% reduction in fees depending on the services utilized, which is a huge win for our users. So we're really proud of that, and we really see that as true embodiment of shared services and cost sharing and bringing resources to providers that wouldn't otherwise be able to access those resources on their own. So where does that leave us with numbers? I know people love numbers. I know I do. With our resource platform, we currently have 1,480 unique users. These users include child care centers, of course, child care providers like family child care homes. They include child care licensing specialists, coaches and navigators. We also partner with different organizations such as Arapahoe Community College, which works with us to provide the resource platform to all of its faculty and students. ACC faculty decided that the platform is such a good resource and such a good tool for new people entering the field to use that they have actually used it to build their curriculum for each semester. And so their students all get access, and the faculty members, the professors, build homework assignments into utilization of the platform. So then when they're graduating their classes and going out into the field, they're really well equipped with a tool to help them, do better and access more and bring those resources to the field. We also partner with ECEA, which is the largest child care association in Colorado, so that their members can receive access, and other similar groups as well. So we have a wide range of users on the resource platform. It goes well beyond, I don't want to say just, but goes beyond just a child care provider, but also to all those people providing support in the field to child care providers. Alliance Corps currently has 127 child care providers, which includes family child care homes and centers, as well as additional partners. So like I mentioned, our Early Head Start development, so our Early Head Start Child Care Partnership Grant team uses the system for oversight and compliance and support. Child care licensing uses the system to remotely access files so that it saves them time when they're on site doing their inspection visits, etc. And so this tool has been able to provide a higher level of efficiency and access not only to the child care providers, but again also to those agencies providing support to the child care providers. Financial services is currently accessed by 9 large child care centers. And then in terms of retention, we track retention on a month-to-month basis, and on average we have 98% retention. And then conversion to paying is one of the things we've been focusing on over the past couple of years. We are, building in a fee-based system, so we're trying to utilize the concept of shared costs to make a sustainable shared services program. And as such, we do have a membership fee that we typically start out scholarshiping a portion or all of the fee if the member needs it. Not everyone starts with a scholarship, but a lot of people do, and that allows them to really realize the efficiencies and the savings before they take the costs on themselves. And currently, 75% of our users are paying all or some of their membership fee. And their membership fee ranges from $100 per year to $300 per month, depending on their level of service and the size of their program. I will say that we have separate fees for financial services because those are so specific and unique to the program utilizing those services. So that's a little overview of our numbers. And next, we're going to look at some of our healthy family or stronger family practice areas. So I'm going to go into a couple of these. One is a Healthy Options for Preschoolers program. This program is supported by the Colorado Health Foundation, with whom we've had a grant for about 5 years now. And it's gone through several different iterations, and what we've found to be the most successful is a Rainbow Snacks program, wherein we work really hard to increase the nutrition and variety of snacks served via Rainbow Snacks. And what we consider to be a Rainbow Snack is a rainbow, which is a fruit or vegetable that can be fresh or frozen, and it cannot include apples, oranges, bananas, carrots, celery, or light green lettuce. And we say those are really healthy foods and they're really healthy options, but we're working really hard to expand variety. So why don't you try strawberries or mango or blueberries, etc. And then the cloud portion of the snack is a lean protein item. So that could be low-fat cottage cheese. It could be a low-sodium deli meat. It could be beans. It could be a lot of different things. If it's a grain, it must be whole grain. And if it's dairy, it must be low-fat. and then all items need to be low sugar, meaning under 6 grams of sugar per serving. And so that is what makes up a rainbow snack, and what we've done is worked on rolling this program out with child care providers across the state, which has been really successful. And then in 2016, we've expanded it to reach out to parents as well. So we have 40 child care providers working with us on this program just in 2016, serving 1,825 children rainbow snacks. And we do 3 months at the child care center at first to get them exposed to the new snacks, and then we move on to 3 months of parent snack pack demos, where the parents provide some pre and post data about serving snacks at home and healthy snacks and access to healthy food and what challenges they face, and then we give them goodies for participating and to incentivize them to continue their participation. We've made a really cute, informative video, which is on the Early Learning Ventures YouTube channel. If you'd like to check it out, it's just over a minute long, and it does a much better job of explaining the program. But that is one of our sort of expansion projects that we've worked on. And then these are a couple of pictures of rainbow snacks in action. So we have kids cutting green beans, we have kids in the grocery store buying avocados, we have parents coming to taste snacks with their kids, and we have, during our snack pack demos, we give them books, we display the food packaging so parents know what types of brands to look for. We give them their own snack pack. We even give them a gift card to the grocery store so that they can go out and really be successful in trying that same snack at home. The next project I'm going to touch briefly on and then turn it over to Tim to speak more about is MERAGEhelp Program. And so our full network has access to our HOP program, Healthy Options for Preschoolers, as well as these additional resources through MERAGEhelp. And this program brings local volunteers to child care program sites to participate in quality-enhancing projects free of charge. And so far in 2016, we've worked with 7 different centers and have had almost $33,000 donated in kind. And we are going to talk a little bit about some of these programs. Tim, I'll turn it over to you to go more into them.
Thank you, Mia. As Mia mentioned, MERAGEhelp coordinates volunteer events for health and safety related or even cosmetic enhancements for child care programs. This particular site is located in Pueblo, Colorado, and this is an example of several a couple similar type projects where we had a space that was too large for a typical infant group, and so it was converted into 2 separate learning environments. The large or awkward space can present supervision issues leading to safety issues, things along those lines, which led us and our child care partner to decide to split it into 2 spaces that, as you can see, on the left is before pictures, and at the end of the project we had 1 space more towards this end of where the photo was taken, and then a separate space on the other side, which isn't quite, at the time this photo was taken, set up into a learning environment. This is just at the finished portion of getting that permanent divider in with additional storage and counter space. As they've been able to continue to set this up as a separate learning environments, they also have added other sound absorbing materials to allow them to function separately, such as area rugs and curtains between the 2 spaces. Both areas have their own separate entrance for parents and for the children and staff throughout the day, and are functioning now as the 2 spaces, one with a group size of 8 toddlers, and one with a smaller group of 4 toddlers on the far end. So that is first example. Next slide, Mia. This particular project took place at a child care partner site in Grand Junction, Colorado. As you can see, the stucco on the outside of the building is cracked and generally deteriorating. This is the view from the playground to entering back into the classroom. And so this is the after picture. We can see that the stucco has been redone. And so this was another MERAGEhelp example. I can imagine that those that are there on a daily basis can certainly appreciate re-entering the building and seeing that, and enjoying that outdoor space more now that that project is completed, or not having stucco crumbling on you as you ride a tricycle by, things along those lines. And this one is at the same site. This is another example of a toddler room being divided into two separate learning environments, one for a larger group, one for a smaller group. In this particular example, the front of the room on the far end it still allowed them to use a shared entry and a tiled floor area for messier activities like meals and art projects that could be used by one group or the other at different times, with gates leading into the two separate areas. Next slide, Mia. Oh. This is a site in Rifle, Colorado, where that has only been open since the beginning of 2016, and at the time did not have any outdoor space available to the children. It was a unfenced dirt lot at the time, and so as you can see now, there is an infant and toddler area out there. Currently, there's also a preschool area in the works. And that brings us to Early Learning Ventures Quality Child Care Partnership Model. ELV is an Early Head Start Child Care Partnership grantee as of February 2015. And this put Early Learning Ventures in a position to launch this Quality Child Care Partnership Model. In order to start this off, we're currently partnering with 32 licensed child care programs across multiple counties in Colorado. That, Mia, can you go back to that visual, please? And that includes 17 licensed child care centers and 15 family child care homes. You can see along the left side of this visual that there are 5 main components to the framework of this model. First is the business development. And this centers mainly around the shared services pieces that Mia described earlier. Participating licensed child care programs will join ELV Shared Services Network, and then these services include the web-based ELV resource platform and Alliance Core technology. The full utilization of both the resource platform and core are supported by the ELV Resource Center that you can see on the visual connecting business development component to the child care partner. And the Resource Center provides technical assistance as it relates to the use of these tools. The focus of this area is to give our child care partners a foundation for quality improvement. The second area is leadership development. For this particular component, program directors and family child care home owners in their administrative capacity participate in a rigorous training program geared toward leadership and sustaining their child care business, and are assigned to an ELV quality improvement specialist. This quality improvement specialist guides the implementation of continuous quality improvement processes, including goal setting, action planning, professional development planning, the facilitation of a professional network, business and strategic planning and supports, and the navigation of the multiple sets of quality standards that child care sites need to be in compliance with. For example, state child care licensing, Head Start program performance standards, state quality rating and improvement system standards, or accreditation, perhaps, for depending on the site. The focus of this area is to enhance the center director's understanding of how to impact program quality with sound leadership. The third component is professional development focused on supports for the classroom staff. And so In this area, teachers and family child care home providers receive at minimum 20 hours of coaching annually to strengthen their understanding of child development and best practice. Additionally, credential and degree-seeking scholarships have been made available for teachers to pursue longer-term professional goals relating to early care and education. The focus is to increase teacher understanding of child development, curriculum implementation, authentic child assessment, and research-based best practice. The fourth area of this program is family development, where enrolled families receive ongoing individualized support from a designated ELV family support specialist and research-based training to enhance their understanding of their child's development, to provide effective parenting techniques and help them to become a stronger advocate for their child. This includes access to in-depth case management to support family goal development, family strength and needs assessments, and assistance with sustainability resources. The focus is both to empower parents by increasing their confidence when navigating community services and resources, as well as to establish consistency in how teachers and parents work together for their child's educational process. And the fifth component is community development. ELV's approach to comprehensive service coordination in each local community focuses on expanded and ongoing partnerships with community agencies in each county to deliver comprehensive services for children. Through these partnerships, focused educational opportunities and supplemental consultation are afforded to parents and staff to ensure children's medical, dental, mental health, nutrition, and other needs are met. Next slide, please, Mia. And so in order to get this model off the ground, the initial group were recruited through ELV's existing network as we looked at which child care partners already maintained an enrollment base of families participating in the state child care subsidy program or other public benefits, and also looking at what their current licensed infant and toddler capacity was in order to participate in the Early Head Start grant. The direct services are made available to the 240 infants and toddlers and their families. However, since many of the continuous improvement goals and processes are geared towards program-wide efficiency and improvement, there ends up being a no-cost incidental impact for the entire licensed capacity for the child care partner sites, which currently is up to 1,700 children at a given time. Next slide, Mia. You can see here what the impact, or some of the impact of the Quality Child Care Partnership model during startup, and where we look to continue to leverage resources to expand these numbers moving forward. And you will notice on the professional development end at the bottom of this slide, we've taken an approach or a mix of either college courses or other professional development goals, such as the Child Development Associate. And we'll continue to look for opportunities to expand that as well. Next slide, Mia. This is an example of one child care partner that joined the Quality Child Care Partnership model about a year ago, who hadn't been in business for all that long, but did have a full enrollment, as she was one of the few providers in that area, and but at the time for her business did not have a bank account, budget for her business, adequate supplies and equipment, minimal professional training, or a degree, for example. And so, next slide, Mia. Over the course of the past year, or at least over the following 6 months, we were able to capture some of the changes that she was able to experience and efficiencies that she was able to enjoy, as well as the enrolled families. So, next slide, Mia. 6 months later, approximately, Brittany estimated that that through the use of the Alliance Core technology, she saved a significant amount of time on attendance tracking and record keeping and billing, as well as through a significant amount of time saved through for tracking subsidy meals. She also reported that she was able to reallocate that time for planning activities for the group of children, as well as for her own professional development in taking college courses and having some study time for that. So some of the other financial benefits that she was able to experience are through participation in the Early Head Start grant, was receiving additional layered tuition in the amount of, at least in the first year, $7,500 per child on an annual basis. That is up to a maximum of 4 Early Head Start children included in her licensed capacity, as well as roughly $6,000 in equipment and materials that ranged from furniture for the learning environment to other furnishings like carpet or learning materials, curriculum materials, things along those lines, as well as the college tuition assistance. And then in addition, during that same time frame, received $1,600 in additional funds through the new Colorado QRAS, Colorado Shines, as a quality stipend. Other efficiencies experienced are the opportunity to be reimbursed for some monthly program supplies, such as diapers, wipes, and formula, as well as savings on food on a monthly basis through participation and ease of use with the food subsidy program through CORE, resulting in a bottom line of roughly $3,000 per month in increased revenue for a small business. Next slide, Mia. At this point in the presentation, I would like to turn this back over to Judy and Mia.
Thank you, Tim. This is Judy again, and we will get to your questions at the end. So just another example we wanted to highlight. Here's another one of our members, Rebecca Fuller, who has been participating with us using the resource platform specifically, and that's enabled her to get support to reach, she's one of the very first 5-level rated in the new quality rating improvement system, Colorado Shines, and she was able to do that with all of the supports that come down from the business services, from the resource platform, from having a quality improvement specialist that helped her with that, using Alliance Core, participating in healthy options, as well as all the support that's been wrapped around her and her children and families with the Quality Child Care Partnership. But she was honored by the Office of Early Childhood and specifically talked about being part of ELV and shared services and access to the technology and the supports, as well as the coaches on the ground that support her. So we wanted to highlight her too. Next slide, Mia. And then lastly, just a couple of additional projects that we're working on. Some of the things that we've done is we were actually selected to participate in the Unreasonable Institute. That was something really unique. That was a ECE Innovation Forum that was bringing private and nonprofit sectors together for a full week, and it allowed us to meet with mentors to talk about, and what they specifically were looking at is to work with entrepreneurs that were selected to attend this, and then to help work with mentors and nonprofit officials to how do you scale these innovations in the early childhood sector to get better outcomes for children. So we are very privileged to get a week of training and connection to a lot of different mentors in the private sector as well as the nonprofit sector to help think us through how shared services could be scaled in this way. Also participated with Louise Stoney in the BUILD initiative, looking at QRIS and connecting it to shared services, really looking at how does the resource platform connect and act as a tool to help states bring down resources to providers and dollars into their businesses. We're also conducting a return on investment study right now with APA Consulting. We're looking at all of the pre-data on specifically the providers that we've been working with over the last few years and looking at how they've run their business and where they spend their time prior to working with us in our business services. And then at 12 months later, are they actualizing the cost savings, and where are they, how are they allocating that, and looking at that return on investment of the cost for them to participate and how much return value they get. So that should be published in 2016, as well as we're working with a firm out of DC, the Policy Equity Group, really doing an evaluation on the early Head Start Quality Child Care Partnership work that we've been doing. We've just come out of the 18-month startup, so that ended in July, and we did a pre-data evaluation of the providers, the 32 providers that we're working at, looking at where they were at with their program, where children assessments were at, as well as parent surveys, and now we're doing all that post-evaluation to see the change that has happened, along with having access and strong support to the business services, as well as all of the early Head Start supports they're getting. So those are kind of the projects that we're working on. Next slide, Mia. And then just to kind of talk to you guys through this, I'm going to have Mandy Potts, our Finance and Grant Director, just sort of talk about, like, one of the big things for us becoming a charitable organization is we do have a diversified funding place now, and just talk through that a little bit.
Sure. My pleasure. We are originally funded by the David and Laura Mirage Foundation, but we've been able to expand that and diversify it, as Judy was saying. We get funding from the Early Head Start Child Care Partnership, as well as the Office of Early Childhood for the Race to the Top grant. We get funding from Colorado Health Foundation, from the Mile High United Way through the Child Care Tax Credit, and through our different levels of ELV affiliate revenue. But most importantly, what we want to point out is we just had our 2015 financial audit with EHS-CC, and their findings were that 95% of the funding that we get goes directly to ELV program services. We're special in a way that we are housed under a corporation that pays for a lot of our internal processes, or HR, etc., that we don't have to pay for them with our program dollars. So what we found is that 95 cents of every dollar that we get goes directly to the program, and we're really proud of that.
Thank you, Mandy. And that concludes kind of what we wanted to share with the group. I know we have a couple of questions in terms of sort of the business model. So the first question was about financial services, I believe.
Yes, it was the 30 to 50% reduction figure.
Yeah. Okay. So actually, where that's specifically coming from is the financial services. For us to pilot that with our providers accessing that, they paid a portion, and then we scholarshiped and paid the other portion. And after we found efficiencies, we updated core. Those that are still remaining on financial services, they actually, the 50% that we were paying to 30%, that went away, but their pricing did not go up. So that returned was directly to the providers, because when the providers choose financial services, they get another agreement with JATASA. So we've been able to lower, and our goal was to get that rate to lower to the providers. So that's where the 30 to 50% discount has come in. And then Mia, do you want to take the question from Louise on our users? I can tell you that of that 127 users, 107 are centers and 20 are homes. And if you could kind of address her question on what is the typical makeup. And that's just about clients for users.
The other thing I would add about financial services is we're able to provide access to the financial services that a small for-profit child care, or even a large for-profit child care, wouldn't be able to access on their own. And so because JATASA only works with nonprofits, so that would exclude access to anyone except a nonprofit child care center to begin with. So they're able to access financial services through ELV, and then it sounds like there's still a question about financial services. And basically, we started with a pilot group of child care centers, and let's say they were charged, let's say the cost at the time of the pilot was $1,000 a month, just so we have like a nice round number. ELV scholarships 50% of that fee. So the provider paid 50% and ELV paid 50% to JITASA. And as we were able to gain efficiencies through growing the group of provider sites, so growing from 1 or 2 pilot sites up to, we have 9 large providers currently participating, the scale alone allowed JITASA to become more efficient and more specialized in what they were doing, as well as the updates we did to Alliance Core, because JITASA uses Alliance Core to direct the tuition billing and collection piece of their work. Those gains resulted in a lower cost for them to do the work. And so at the end of the pilot, JITASA said, we can do this work 30 to 50% more efficiently, so that's a 30 to 50% lower cost to the people participating. And so we were able to keep the fee the same for the providers and the scholarship and not increase the fee to the providers at all. I don't know if that helps, and if it doesn't, if you have more specific questions, let me know, or we can even talk further about it, you know, in a follow-up conversation if that would be more helpful. And also, if anyone else has questions, you can type them into the chat box so we can answer them. And then, Louise, regarding our breakdown of participating members, right now we have 20 family child care homes using CORE, and they range, you know, a family child care home is a typically smaller size, typically in Colorado licensed for 8, but some of ours are licensed for larger numbers as well, up to 12 children per day, I believe. And then in terms of centers, we have 107 centers using the system. And I would say the average size of a center is around 60 kids. We do have some pretty large providers using the system, as well as some, you know, more small child care centers like with 20 kids. But I would say on average, we average around 60 children. And it looks like there's another question about child care subsidies in the Early Head Start Child Care Partnership Grant.
Yeah, this is Judy, and I'll answer that. So Louise, the way that we have done that is when we had our child care partners apply for this grant, they were actually already licensed child care programs serving families on the subsidy. So what we did is we looked at the mix-up of their subsidy and those that would also qualify for Early Head Start, and that's how we were able to layer the tuition on. So of course through attrition, you know, our family support specialists are out there recruiting as families age out or move on or whatever. They recruit specifically working families that are on CCAP, or they'll help them navigate through to get on CCAP and enroll in the child care program. So that's like the base funding that the child care program would be getting to serve that family. And then what we're able to do is at the same time see if they're eligible and qualified for Early Head Start services, and then that allows us to layer that tuition onto the CCAP. We do have a few children for different reasons in Colorado and different counties that may fall off CCAP and for different reasons are unable to get on it, and so we have some funds that we will give some scholarships for, but I would say, Tim, 95% are actually on the subsidy already, and then the layered tuition of Early Head Start.
That's close, maybe closer to 90.
Okay, 90%. All right. But we offer scholarships. Any other questions? Well, if you guys do, you know how to reach us. Our website is earlylearningventures.org. If you wanted to see some demos, we do have demos of all the services, the resource platform, Alliance Core, as well as the HOP program that Mia talked about, and we're happy to have any further conversations. Again, thank you guys so much for joining us today, and we hope that we were able to just share some of our accomplishments and what we've been doing.
And we will send out the slides to everyone as well.
Great.